Professor Sultan is from Applied Psychology Department from Bahaud-din Zakariya University, Multan, from Pakistan.
From Pakistan, yes. Hi everybody, good morning. My presentation is about the women's mental health in Pakistan, a comparison between infertile and fertile women. I would just discuss the very short rationale of my study. It is basically an empirical study about infertile women. Issue of the mental health has always been of paramount significance for the women in general, but for those women who have been diagnosed with the problem of infertility. Is discussed and researched least in the present literature. Like many other agents of women's mental health, fertility is also closely wedded to mental health, and there is no question that infertility as a stressful life event influences on mental health of the women. Since motherhood has significance for women in a society, but not having a baby is a stressful condition that brings a heavy psychological trauma for infertile women. Infertile women always try to look upon a diagnosis and the treatment for their problem, and due to the psychological influences and failure of treatments, their mental health come to a double risk for the stress. For most of the women, the uncertainty about the results of infertility treatments brings the emotional and psychological threats of being failure and childlessness. They become depressed, socially isolated, and anxious. Women who experience the loss, failure, and disappointment of not being pregnant repeatedly every month report more frequent and regular signals of depression, anxiety, and aggression than the fertile women. The ability to reproduce is viewed by women as central to an individual's core gender identity, self-concept, and body image. It is common for infertile women trying desperately to conceive to experience the sexual difficulties and in their relationship than the fertile women as well. Continuing the advances in the research of the women's mental health, infertility and its impact on the mental health has been debated again in the current study to strengthen the literature discussed here. So the objectives of the present study, I have just only the three objectives. The number one objective was to measure the mental health of infertile women in terms of their depression, anxiety, aggression, self-esteem, marital satisfaction, and sexual satisfaction. The second objective was to compare the mental health of the both groups, the fertile and infertile women. The third objective was to analyze the infertile women's mental health in relation to their demographic aspects or the demographic variables. On the basis of these objectives, I formulated the three hypotheses. The number one hypothesis was infertile women will be more depressed, anxious, and aggressive as compared to the fertile women. And the second was women, when will be diagnosed as infertile, will experience the low levels of self-esteem, marital satisfaction, and sexual satisfaction than fertile women. It was assumed in the third that mental health of infertile women will differ in relation to their demographic variables like age, education, income, language, family system, and their living area. Methodology was very simple. The sample consisted of 400 women evenly divided into the 200 infertile and 200 fertile women. Their age range was 20 to 65 years, and to select the sample, the convenient sampling technique was utilized. It is a technique of the non-probability sampling. Then they all have been actually taken from the different cities of Pakistan. All the sample, fertile and infertile, were actually differ on the demographic variables of the age, education, income, language, family system, and area. They were not matched on these variables. The research design, the study was basically descriptive and research, and therefore the survey approach was considered the appropriate and was adopted for the data collection. Between subjects research design was utilized to compare the two groups of infertile and fertile women and to answer the research question. The instruments used in this study were firstly translated and validated through the pilot study, because the first language in Pakistan is not English. We have the Urdu language, so it was very important and significant to translate these scales into the native language. The first group of the scales were the Beck depression and the Beck anxiety inventories. BDI and BAI both have the 21 items. They have actually the 4-point rating scale, that is the Gutman scale, rating from 0 to 3, and the score is calculated simply by adding the responses for the 21 items. The third one scale was the aggression questionnaire. It was developed by Bush and Prey in 1992. It has the 29 items with 5-point rating scales 1 to 5, showing least to the highest ratio of the aggression. Items 15 and 21 will be reversed code to obtain a total score on this scale. The three different scales, a group of the 3 indexes for self-esteem, marital satisfaction, and sexual satisfaction, taken from the Hudson package of these scales. It was developed in 1981. It has every index has the 25 items with 5-point rating scale, and score is calculated simply by adding the responses after reversing some items on each index. For each scale or the index, the cutoff score is 30. A score above 30 indicates a clinically significant problem in the area being measured, while those who scored below 30 are generally free of such problems. Procedure was very simple. Sample was approached as discussed in the sampling section, and a booklet of scales containing the demographic variable sheet was given to the participants. Instructions were given to them about how to fill the questionnaire. Confidentiality was assured to them. And in the end, the data was analyzed through using the SPSS, the Statistical Package for Social Sciences, the version 17. Results, table 1 is showing the differences with the application of the independent sample t-test, and the results are showing that the infertile sample has the greater distress in terms of their depression, anxiety, and aggression, and they have the low levels of self-esteem, marital satisfaction, and sexual satisfaction as compared to that of the fertile women. The t-values and the p-values are clearly showing that differences are significant at the level of 0.001. Table 2 is simply showing the mean in relation to the different demographic variables. Age was actually divided into the 3 different groups, and the educational qualification and their income level, language, family system, and the living area. So the table is clearly showing that the mean differences is high for the infertile sample, not for the fertile sample. We can also see these differences through the pie chart, that you can see that the differences in their level of depression, the high degree with the yellow color is showing clearly that the high ratio is greater for the infertile women. And this is, second one is for the anxiety, and the third one is for the aggression, and the results are same, that anxiety and aggression is high for the infertile women. Then there is results about the self-esteem and marital satisfaction and the sexual satisfaction, and the results are showing that the ratio is divided into the 2, as I discussed in the instruments part, that the scale has the cutoff score of 30. So on the basis of this score, the sample was divided into having the low and high self-esteem or the marital or sexual satisfaction. There is just one mistake, that I have actually just written the couples. It's not the couples, it's the women group. Yes, the table 3. Table 3 is related to the results about the infertile women, specifically the infertile women, in relation to their different demographic aspects. And one-way ANOVA was applied through the SPSS, and the results are significant only just for the age for education and for family system. It does mean that these three different variables are basically significant, and they actually play a role in the determination of their level of all the things that I have actually studied in my research: the depression, anxiety, aggression, self-esteem, marital and sexual satisfaction. But the results are showing the non-significant results for the income level and for the living area and for the language. These three different variables are not playing the significant role. So I will come to my conclusion that it is deduced from the study that infertile women's mental health is at more risk due to their infertility problem. They experience high depression, anxiety, aggression, and report low levels of self-esteem, marital, and sexual satisfaction. The second one, the results indicated that infertile women's age, education, and family system are the significant variables in determining the mental health of the infertile women. So it was also found that level of income, language, and living area don't play any significant role in the evaluation of the mental health of infertile women. Lastly and finally, it can be concluded that the inability to conceive is the devastating problem and intense crisis in the life of the woman. So on the basis of this conclusion, I would must recommend, especially of course these results are just related to the Pakistan study, so these recommendations are for the population of the Pakistan. It is recommended that the further research is needed concerning the psychological interventions with infertile women or couples in light of the relationship found here between some demographic variables and infertility. Second one, I have suggested that counseling centers should serve for community to minimize the stress that infertile women evoke when they interact with the public people. There is a need to educate the people that there is no way to blame infertile women for not having child, because it can damage the quality of life of infertile women or couples. For this regard, in Pakistan, psychological interventions must be introduced, and psychologists must be trained to treat and reduce the distress of infertile women, as women's mental health is vital requisite for well-being of any society. I will must acknowledge the limitations of my study. My study lacks the external validity due to the two reasons. The number one is the sample size utilized in the study is not large enough to represent the whole population of this kind, and the sampling technique is the non-probability sampling technique, that is the convenience sampling technique. So it's not a ideal technique to select the samples. So for the representative sampling, must we actually choose the probability sampling. So for the representative sample, the sample size should be large, and the probability sampling should be a idea for the representative sample. My study also has the internal validity, because I just has actually controlled some variables, but these three variables, in the end of the study, I identified that they actually can play a role in the fixation or in the determination of the infertile women's mental health, like if they are working or non-working, if they adopt the child, or what's the period of their infertility. So it will also play work and will do something with the mental health of the infertile women. So I would suggest that these variables should be studied in the future study, and the study may well be replicated with other variables, exploring some more variables which could be associated with infertile women's mental health. So this is my research and its findings. Thank you very much.